Yes, sir.
So next topic we were going to discuss, that was about viral hepatitis. We have seen earlier what is hepatitis, that is inflammation to liver. We have seen various causes for that. We have seen alcohol or other chemical assaults or injuries by various ways that can cause hepatic injury. Only thing diagnostic or what we can say pathological features, they somewhat differ in these people and various conditions, and therefore only because of that we classify them in different way. Basically all are ending with a problem, that is decrease in the hepatic functioning, and because of that the worsening of situation. We have seen various conditions, various reasons, and basically various hepatic function tests in the beginning to see that what happens to the hepatic functioning, and accordingly in earlier we have seen in cirrhosis. So basically these all are resulting into cirrhosis gradually. We have seen the in earlier presentation we have seen that how gradually it changes, that is up to certain period of time it is reversible or it is controllable, but once it becomes fulminant or widespread fulminant means, then it becomes difficult to control, and it is very difficult to save the person. So let us see how viruses they are affecting liver, and how we can go for the various activities, various treatment modes and diagnostic mode. Let us see. I am using the latest one version using this Wikipedia, because many times whatsoever data it is there, you can refer the book by Government of India which I have shared last time. Here it is in abbreviated and smaller form, so it is good for presentation. You may read, there are 2-3 such guidelines are there, and even Government of India has got 2-3 guidelines on this. You can refer this, you can search it. So let us see how it is transmitted. So it is transmitted through contaminated food or water, particularly hepatitis A or hepatitis C, or via blood or body fluids, particularly hepatitis B and hepatitis C. Again, blood means blood transfusions are there, syringes are there, body fluids are there, including the sexual contacts are there. So these are various ways by which these are transmitted. Particularly injections, again when we say parenteral injections, then particularly it is more common in the drug abusers, because they share similar needle and they are having very high rate of transmission. So these viruses get transmitted through water and food, are mostly self-limited, resulting in acute illness with the full resolution. They are not as dangerous as the hepatitis B and C, but the blood-borne viruses are villainous, that is very dangerous and notorious to persist in the body for long. They induce scarring, liver cancers, and the liver cirrhosis. The most common type of hepatitis can be prevented and treated. In last few years, fortunately, vaccines are also available, which were not there earlier. Around in last 10 to 12 years, the vaccine development was there, and the vaccines are there in the market, particularly for hepatitis B, and many people they have got immunized themselves for this. Hepatitis A and hepatitis B can be prevented by vaccination, as I told you. The effective treatments for hepatitis C available, but it is very costly. In 2013, around 1.5 million people died from hepatitis, and most commonly due to hepatitis B and C. Particularly Mongolia is the most affected region in the world. Even India has got a very good amount of people having this hepatitis, particularly virus hepatitis, and this data is very clearly given in the this guidelines, government guidelines, which I have mentioned over there. But only thing is, in India we don't have that prominent recording system. So the data we may not exactly treat with, there are many chances that data will be more than that. So there are various 5 important hepatitis species. Apart from hepatitis, other viruses are also there which are known to cause this hepatitis. So important are, most prominent are hepatitis A, B, C, D and E. So these are the various viruses. Abbreviation are HAV, HBV, HCV, HDV and HEV. So these are various viruses: hepatovirus alpha, hepatitis B virus, hepatitis C virus, hepatitis delta virus, and orthohepavirus. These are the name of these various these things. The family of these are one is picornaviridae, other is hepatnaviridae, then claviviridae, then insecticides. That is not very important for you. And genome is the hepatitis A is having single stranded RNA, SS means single stranded. Hepatitis B is double stranding DNA and reverse transcription that takes place in this. Again, the next are single stranded RNA. The antigens are found for this. Just a minute, just hold on. Antigens are found for particularly hepatitis B, hepatitis C, and hepatitis D. Just 2 seconds, please. टोकन झाले का जनरेट? टोकनची काहीतरी तो पावती बनवून घेतो ना, छोटीशी टोकन सारखं कागद बनवतो तो. तिकडनं आणतो का काय? एवढंच ना. So the antigens for these means these viruses, they have antigens on their coat. These are HBs AG and HBe AG. These antigens, they serve as a very important purpose of diagnosis and help. That is that once these antigens are diagnosed, then it means that the hepatitis B is present. So these antigens are very important. Transmission is enteral, that is oral route, as we have seen, food and water. But these two are enteral, that is A and E are enteral, that is food and water, we have seen earlier. And the other are parenteral, that is blood and the fluids, we have seen it. Incubation period is around hepatitis A is having 20 to 40 days. Then B is having around 45 to 160 days. Hepatitis C is having 15 to 150 days. Hepatitis D is having 30 to 60 days. And E is having 15 to 60 days. Initially, it will be mild and acute. Then it won't have a big problem. But hepatitis B, occasionally severe it becomes. 5 to 10% will have chronically present hepatitis B, and it will appear. This hepatitis C is always subclinical, only 70% will be having chronic. The hepatitis D itself is not having big problem, but it complements hepatitis B and it exacerbates, that is, it increases the problem with hepatitis B. So it is usually present and it affects the hepatitis B. So individual hepatitis B, suppose hepatitis B is there and simultaneously hepatitis D is there, then the worsening chances increases many times. Then hepatitis E virus, mild and normal in normal patient, but in pregnant women it becomes severe, and in acute condition it will be there. Now what are the impacts of the vaccines? Hepatitis A vaccine gives 10-year protection. For hepatitis B there are 3 injections and it gives lifetime protection. For hepatitis no vaccine is available. For hepatitis there is no vaccine, but hepatitis B is there because we have seen that hepatitis D itself is not making any difficulty, but when it causes increase in the problems with hepatitis B. So if somebody has immunity against hepatitis B, it can also get protected against hepatitis D directly. Hepatitis E only under investigation and not yet approved. So this is various hepatitis. So these are various hepatitis are there. The patient immune system will make antibody against hepatitis A virus, and that will give immunity against the future infections. People with hepatitis A are advised to rest, stay hydrated and avoid alcohol. A vaccine is available that will prevent infection up to 10 years, we have seen just now. It can be spread through personal contact, consumption of raw seafood or drinking contaminated water. Occurs primarily in third world countries or those which are underdeveloped country to what we can. Strict personal hygiene and avoidance of raw unpeeled foods can prevent this infection. Infected people excrete this hepatitis A viruses with their feces 2 weeks before and 1 week after the appearance of jaundice, and the time between infection and start of illness is average 28 days. The most people recover fully within 2 months. Some of these are sufferer may experience continuous or relapsing symptom for 6 months to a year after initial diagnosis. So how we are going to go for diagnosis? What are marker? Presence of fecal hepatitis C virus that will appear in 2 to 4 weeks or 28 days of appearance. IgM antibodies will be appearing in 4 to 12 weeks. IgG type of anti-HA, these antibodies will be there in the after 5th week, and then it will be persistence in the body. We can have this enzyme immunoassay for antibodies, and we can give, these are the diagnostic activities for that. Hepatitis B is a very common one, as we have seen. It is also known as a hepatoadenovirus. It can cause acute type or chronic type of hepatitis. Chronic develops in the 15% of adults who are unable to eliminate the virus after initial infection. Identified methods of transmissions are blood transfusion, now rare because the blood banks are very stringent conditions has been put. Earlier it was one of the very important source. Unsanitary tattoos, sex through sexual intercourse or contact with the body fluid, we have already discussed it. Mother to child by breastfeeding, because we have seen blood and fluid. And important is syringes used by these drug addicts, who use each other's syringe. There is a minimal evidence of transplacental crossing. About half of the cases of source of infection cannot be determined. Blood contact can occur by sharing syringes, yes. In intravenous drug use, as I told you, basically doctors, they do not do it, but yes, do not do this sharing of the syringes. But it can occur in the small places where the people are not much aware or doctors are scrupulous one, or it can occur in drug addicts where they are using these syringes. Shaving accessories like razor blade, touching wounds, infected person, needle exchange program have been created by many countries as a form of prevention. So these are various ways by which it can spread. These are the causes. Patient with chronic hepatitis B have antibodies against virus, but they are not enough to clear the infected liver cell. The continuous production of the virus and this countervailing antibodies is a likely cause of the immune complex disease which is found in these people. Vaccine is available and it can give lifetime. We have seen that hepatitis B infection result in around 5 lakh to 12 lakh deaths per year worldwide due to complication of chronic hepatitis, cirrhosis and hepatocellular carcinoma. These are the, if you go or if you remember earlier class slide, in that we have discussed this. Hepatitis B is endemic in number of like South Asian countries. They are making cirrhosis and hepatocellular carcinoma as a big killers in these countries. There are 8 treatment options which are approved by US FDA available for the person with chronic hepatitis B infection. These are alpha interferon, pegylated interferon, adefovir, entecavir, telbuvidine, lamivudine, tenofovir, then disoproxil and tenofovir allanfenamide. They are having overall 60% of the rate of sustained response. So only we have seen in hepatitis A, we have not seen a treatment. Here we can see this treatment which is there. These are 6 important treatment available. Sorry, these few treatments are available like interferon. Interferon and pegylated interferon means what? That is PEG, that is polyethylene glycol. That polyethylene glycol, in that when interferon is added, then its release is sustained. So this is known as a pegylated interferon. So interferon, pegylated interferon, adafovir, entecavir, telvividin, lamivudine, tenofovir, disoproxil, and tenofovir alanfenamide. These are particularly important treatment. Then hepatitis C. Earlier it was called as a Na and B hepatitis, that is, it is not of A type or not B type. And later, for clarification, the nomenclature is simply given, that is hepatitis A, B, C, D, E, like that. It is caused by hepatitis C virus. It is a RNA virus of family Flaviviridae. We have seen all this table earlier. HCV can be transmitted through contact with blood, including sexual contact, just like if whatsoever through fluid and through enteric, that is food and water contamination. Only 2 important sources are there. So this has got blood and fluid. So same as hepatitis B it is having. It usually leads to chronic hepatitis. It culminated into cirrhosis in some people, but it can remain asymptomatic for decades. Patients with hepatitis C are susceptible for severe hepatitis if they contract either hepatitis A or B. So all persons with hepatitis C should be immunized against hepatitis A and hepatitis B if they are not already immune. They should avoid alcohol. One thing is there, if along with hepatitis, if somebody is prone to have other toxicants, maybe the drugs or chemicals which are causing liver toxicity, or those who are using alcohol, then they are highly prone. Their chances, they increases by many fold. So everywhere it is, you will find written that this should be avoiding, or they should taking care about it, because already liver has got inflammation because of these viruses. Virus is affecting liver, and simultaneously the burden falls on other cells. So if in that the any chemical, may it be alcohol or may it be any drugs like paracetamol or isoniazid, rifampicin, there are many drugs are there. If these drugs are there, then it will affect liver more, and the person otherwise able to tolerate will not able to tolerate. Means it is just like a single attack and double attack or multiple attack. So just like that, when it is single attack, maybe of viruses or only of drug, then maybe a person would have able to sustain it. But when it is multiple attack, then the chances of injury or the growth or fulmination increases. It can lead to development of hepatocellular carcinoma. However, only minority HCV develop cancer, only around 1 to 4%. That suggests complex interplay between this viral gene expression and host and environmental factors which promote carcinogenicity. The risk is increased twofold with active hepatitis B virus infection, and around 20% increase in the mortality compared to latent or only single HBV or HBC. Viral levels can be reduced to undetectable levels by combination of interferon and antiviral drug ribavirin. The genotype of virus is primarily determinant of the rate of response for the treatment regimen. With genotype 1 is the most resistance. The hepatitis C is the most common chronic blood-borne infection in the United States. So what are the diagnosis and what treatment will go? So what are the markers for that? That is HCV RNA is a marker, anti-HCV antibodies are there, they can be found, and ALT, that is alanine transaminases. We have seen that SGOT, SGPT we have seen earlier. So when they will be there, the first one will be available, or that can be seen in 1 to 3 weeks or around 20 days. The anti-HCV can be seen in 5 to 6 weeks. Then this ALT will be observed in 5 to 6 weeks. It is done with PCR, that is polymerase chain reaction method. Most probably with this COVID period, PCR, RT-PCR There are so many videos, so many things are appearing on WhatsApp and various such channels. So this is a polymerase chain reaction by which RNA can be detected. Then antibodies are this anti-HCV antibodies are detected with the enzyme immunoassay for antibodies. ALT is a normal liver test which is available. It demonstrates the presence or absence of virus. The first one, the anti-HCV will show that how many antibodies are developed. So what can be the approximately duration for that, and the peak in the ALT coincide with the peak in the anti-HCV activities. That means the body is trying to protect it. The result may be intermittent during the course of infection that is related to HCV RNA. Negative result is not indicative of absent. We in our terms we have got in case of COVID also you might see these terms very important. In test, if you have read some newspaper or articles, you will find we call them as a false positive, false negative. There are antigen testing nowadays occurring at many places. So antigen negative person or antigen negative can be a false negative can be there. False negative means what? False negative means the person is otherwise positive, the virus is present but it shows negative. That means it shows that there is no virus. So we call them as a false negative. False positive means there is no virus, still the test shows that there is a presence of virus. So this false positive, false negative, they can occur with various tests. Similarly here the negative result is not indicative. That means it can be a false negative, and that means one should not be rely upon it. Other tests one can do. Then anti-HCV high false positive in those with having autoimmune disorders and population with low virus prevalence. In that it can be high false positive again. That means there is no virus but the antibodies are produced, particularly as a response or autoimmune response, or might be virus has entered the body in very small titer, in very small amount, and that small amount the body has taken care of. Antibodies were formed, but that they will be remaining for a long period of time. That will show that it is there. Fluctuating ALT levels is an indication of active liver disease. Only this shows that liver is affected. Then next is hepatitis D. It is caused by hepatitis D virus, that is HDV virus, we can call it as a hepatitis delta virus. It belongs to the genus delta virus. It is similar to a satellite virus, and it can only propagate in the presence of hepatitis B virus. So depending on the helper function of hepatitis B for its replication and expression, the hepatitis D has no independent life cycle. If there is no hepatitis B, then even if hepatitis D is there, it will not remain in the body, it will not develop, it will not grow. Okay. It can survive and replicate as long as HBV infection is there, that is present in the host body. It can only cause infection when encapsulated by hepatitis B virus surface antigens. So the vaccine for hepatitis B will automatically protect against hepatitis D virus because of its dependence on the presence of hepatitis B virus or to replicate. Then next is hepatitis E virus. We have seen that it is also transmitted by food and water, that is enteric. This one, it produces symptoms similar to that as hepatitis E, although it can be fulminant course in some patients, that is it can spread, it can grow rapidly in some patients. Particularly in pregnant women, the mortality rate is about 20%. The chronic infection may occur in the immunocompromised patients. It is more prevalent in the Indian subcontinent. The virus is feco-orally transmitted and usually cell-limited. Feco-orally means it is excreted in the feces. Suppose in many places in India, the people, they don't have their own toilets, so they go at a common place. Sometimes it is washed in some near water bodies. So from these feces it goes to water. That water bodies are contaminated, and if the water is taken as such, or maybe these are used somehow this water or the feces, they go somewhere near any food item. So this is we call as a feco-oral transmitted, and usually it is self-limited. Then Hepatitis F virus, it is a hypothetical virus which is linked to certain cases of hepatitis. Several hepatitis F virus candidates emerged in the 1990s, but none of these reports have been sustained. So not at present we cannot see that there is something. Then next is Guillain-Barré virus, that is GB virus. It is also potential virus cause of hepatitis that is spread by blood and sexual contact. It was initially identified as hepatitis G virus. It is very little evidence that virus causes hepatitis, as it does not appear to replicate primarily in liver, so it is therefore called as a Guillain-Barré virus. Most important thing is there, we have seen that the liver inflammation, whenever there is inflammation to liver, that injury when is getting tried to repair, and this while repairing there are changes that takes place in the tissue level, that normal cells are replaced by the fibrous cell, and accordingly one by one the area that becomes, we have seen in the picture of cirrhosis. Apart from that, as the inflammation progress, because inflammation is the first, it is inflammation, that means it is because of injury. So initially there is a liver injury, then from liver injury, that is that injury gives rise to various invitation to various cytokines and various such factors, chemotactic factors, they will come over there. While these all are the what we can say participants or factors of hepatitis. So this injury will be having inflammation, that is hepatitis. This hepatitis, when it will be tried to be repaired, that will converted into fibrous tissue. Then this fibrosis we call as a cirrhosis, and this cirrhosis, as we have seen that it has got, this cirrhosis means that much part which is repaired with the fibrous tissue that does not have any functional capacity, and that will become non-functional although the cells are replaced, and we can see the portions on liver like that. So these are all various kind of hepatitis are causing it, but in most of the, in some of the cases, this apart from cirrhosis, most of these are causing the liver cancers. Example, hepatitis C virus are causing acute and chronic infection, and that are the major causes of hepatocellular carcinoma, and they are advanced hepatofibrosis and cirrhosis they can cause, which is a major cause of death in the this human hepatocellular carcinoma with chronic HCV infection, that is the presence of cancers in that. The pathogenesis of cancer that is associated with HCV, that virus plays direct and indirect roles. The major risk for the development of this carcinoma is persistent infection of hepatitis C virus, and the highest risk for this cellular carcinoma development is associated with the co-infection of hepatitis B or hepatitis D, hepatitis B and hepatitis D simultaneously, or HIV and HSV, that HCV. So these are various reasons which are resulting into hepatocellular carcinoma. The risk factor that are leading to the development of hepatocellular carcinoma in chronic HCV synchronous liver diseases, viral genotype, lifestyle factors, and presence of obesity and diabetic mellitus. These are various additional risk factors which are there. The lifestyle factors like smoking, alcohol use, and coffee drinking, they are accelerating the progression of hepatocellular carcinoma, in particularly this HCV infected people. The purpose of HCV treatment is to eliminate the infection, reduce the transmission to other people, and decrease the risk of this cirrhosis as well as HCC development. These are the goals we call as treatment goal is this. Apart from this, there are many viral agents are there which are causing hepatitis. Example, the first virus was known as a yellow fever virus, which was a mosquito-borne flavivirus. Other viruses which can cause hepatitis, they are adenoviruses. Then arenaviruses, example are guanarito virus, Junin virus, Lassa fever virus. There are so many viruses are there. Okay. then Bunia virus and their species coronavirus, a severe acute respiratory syndrome virus is there, that is corona. Corona basically, COVID is a different virus, means COVID is one of the coronavirus. Okay, coronaviruses are existing since many years. So coronaviruses, they can also cause liver problem, erythrovirus, then filoviruses, flaviviruses like dengue, etc. Then herpes virus, cytomegalovirus virus, Epstein-Barr virus, varicella zoster virus. These all viruses, particularly, they are more discussed while you study antiviral drugs. Herpes, cytomegalovirus, which are causing cancers, Epstein-Barr virus, varicella zoster virus, human herpes virus 6, herpes virus 7, herpes virus 8, etc. Then orthomyxovirus, like which is causing influenza. Then picoma viruses, which causes ecoviruses and other such viruses. So there are variety of viruses are there. However, most important are to what we call as a hepatitis A, B, C, D, E. So you can just remember that other viruses can also cause it. However, the most important, most prominent are these particularly various viruses. We will have a quick look at hepatitis B into this. That this hepatitis B is infectious, which is caused by hepatitis B, as we have seen. The symptoms are some people may not have any symptom during initial infection, and some may develop a rapid onset of sickness with vomiting, yellowish skin, tiredness, dark urine, abdominal pain. These symptoms takes few weeks and rarely does initial infection result into death. However, it may take 30 to 180 days for symptom begin, and those who get infected around the time of birth, 90% will develop chronic hepatitis B, with less than 10% of those infected at the age of 5. Most of these chronic diseases have no symptom. However, cirrhosis and liver cancer may eventually develop in these people. Cirrhosis or liver cancer occur in around 20% of those who are having chronic disease. We have seen how this is transmitted. Okay, it has been preventable. We have seen vaccines are there since 1982, but they are very widely available in around 2006, as I told you, around 10 to 15 years before. These viruses, they came in very big way. So around 10-15 years back, most of the vaccines are there. About 180 countries gave it as a part of national program. It is recommended that all blood tested hepatitis B before transfusion, and the condoms which are used to prevent infection. During initial infection, care should be based on the symptoms the person is having. But if it is not there, then antiviral medication, like we have seen all these drugs, tenofovir, interferon may be used. However, the drugs are expensive, and if still it is not controlled, then if you remember in case of cirrhosis, if you see the treatment chart or treatment algorithm we have made as per the guidelines, we have found that liver transplant is, but if you remember, I told that even Vilas Rao Deshmukh could not get proper match. A very big politician, multiple times chief minister and central minister, and he could not survive because of the liver problem. So around so many people are having signs symptoms we have discussed briefly. Then other signs are there, jaundice are there, and then fulminant hepatic failure can be there, more severe form of liver disease. Fulminant, I told you that where the cirrhosis is very widely spread, and they may die as a result. Infection may be entirely asymptomatic and may go unrecognized initially, and only the jaundice signs are there which will be growing, that will indicate that there is a growth. It is also one of the important contributor for hepatocellular carcinoma. Then it is also linked with the membranous glomerulonephritis. So not only liver, it is also affecting kidneys. The hepatitis B, C, they causes 50% of this hepatocellular carcinomas. So these are the problems. Symptom outside the liver, they are present in around 1 to 10% of these people, like serum sickness like syndrome, acute necrotizing vasculitis, that is inflammation of vessels, membranous glomerulonephritis we have seen, that is the nephrons and glomerulus are inflamed. Then papillary acrodermatitis of childhood, serum sickness like syndrome occurs in setting of acute hepatitis, which before the onset of jaundice it will be there. Clinical features are fever, skin rash, and polyarteritis, that is various arteries are inflammation of various arteries. The symptoms are often subside shortly upon jaundice, but it can persist throughout the duration of acute hepatitis. So it can also cause nephropathy in some of the adults, but it is more common in children. The nephropathy is more common in children. It is the most common form. The other immune medium hematological disorders like cryoglobulinuria and aplastic anemia have also been described in these people. Hepatic extrahepatic manifestation are there. We have seen how transmission is causing. Okay, will not go for this detailed structure and genome and etc. how it works. We'll just go for treatment, how it is causing. Yes, diagnostic, the test we call assay. The detection of hepatitis B infection, they involve serum or blood test. First important is hepatitis B surface antigen is very common, and you can see the graphs are there here. Very nice graphs are there, that what are the figures will be occurring of various types from the day of transmission. What will be if you remember example, if you have studied in first year, you have seen ovarian cycle or menstrual cycle, then you have seen how hormone levels changes. Or if you have seen cardiovascular diseases, myocardial infarction, how various markers may be creatinine kinase, LDH. So similarly, you will find the level changing of the markers and how at what time the markers are appearing, when they go down. Okay, what are various markers which are present, and then accordingly what we can conclude from that. So these are very good graphs which are available, which you may please go through. Again, I am referring Wikipedia, or I'll again you can see the earlier note I have provided, government guideline, in that also it is there. So hepatitis B surface antigen is the most frequently used to screen for the presence of the infection. The first detectable virus antigen to appear during infection, but early in the infection this antigen may not be present and it may undetectable later in infection as it is being cleared by the host. Host will go on clearing it, and then you may not able to detect, but infection is there. The infectious virion contains the inner core particle that is enclosing the viral genome, and the icosahedral core particle is made up of 180 to 240 copies of the core protein. It is alternatively known as hepatitis B core antigen or HBCAG. So this is another antigen which is there. So during this window in which the host remains infected but it is successfully clearing the virus, IgM antibodies which are specific to the hepatitis B core antigen, that is anti-HBC IgM, may be only serological evidence of disease, and therefore most hepatitis B diagnostic panels, they contain HBsAg, that is hepatitis B surface antigen, and the total anti-HBC, that is both IgM and IgG, these antibodies. So that this is a together diagnosis is made for that. Shortly after the appearance of HBsAg, another antigen, that is hepatitis B E antigen, that is appear. The presence of this HBsAg in the host serum is associated with the much higher rates of the viral replication and the enhanced infectivity. However, variants are there for this hepatitis virus. They do not produce the E antigen, and so one can get what we can say confused, or we can say false positive, false negative. Like that false negative, they can show that okay, there is no HBsAg, because there was some of the just like you might have seen corona or in COVID, we say that variety of strains are there, UK strain, Brazil strain. So like that variety of strains are there, and in some strains this hepatitis B E antigen, it will not appear. Antibodies to this E antigen will arise immediately afterwards. The conversion is usually associated with a dramatic decline in the viral replication. If the host is able to clear the infection, eventually the HBs AG will become undetectable, and it will followed by IgG antibodies to the hepatitis B surface antigens and core antigen, that is two types of their anti-HBs and anti-HBC IgGs. The time between removal of HBs AG and the appearance of HBs is called as a window period, and the person is negative for HBs AG but positive for anti-HB antibodies, either has cleared an infection or has been vaccinated previously, therefore the antibodies are appearing. The individuals who remain HBs AG positive for at least 6 months are considered to be having hepatitis B carriers. They may not have any symptoms, but they can transmit. The carriers of hepatitis virus may have chronic hepatitis B, which would be reflected by elevated serum ALT level, that is alanine transaminotransferase level. Inflammation of the liver can be there. If they are in the immune clearance phase of chronic infection, carriers who have seroconverted to HBe negative status, in particular those who acquire infection as an adult, very little multiplication and hence maybe a little risk of long-term complications they can have. So we have test, that is PCR, that is polymerase chain reaction test, have been developed to detect measure amount of this HBeV DNA. We call it as a viral load. So on the basis of viral load, we can understand if the viral load is high, that means infection is high. These tests are used to assess the person's infection status and monitor treatment. Individuals with high viral loads characteristically have ground glass hepatocytes on the biopsy. We have discussed this ground, that is opacity increases of these hepatocytes, we call it as a ground glass. Okay, I am sorry, opacity reduce, and accordingly they will appear like a glass. So there are vaccines are available, there are various vaccines are there. So these viruses are there, and accordingly this vaccination is taking place. There is one method, we call it as Akash vaccination method. Most vaccines are given in 3 doses over course of days. A protective response to the vaccine is defined as a presence of anti-HBs antibodies, that is with hepatitis B virus antibodies, concentration at least 10 ml unit per ml is in the recipient serum should be there. Vaccine is more effective in children, and 95% of those vaccinated have protected levels of antibody. This will drop around 90% at 40 years of age and around 75% in those of 60 years. The production afforded by vaccination is long lasting even after antibody levels fall below 10 ml, that is milli units per ml. And for newborns, this HBs positive mothers, hepatitis B vaccine alone or hepatitis B immunoglobulin alone. हाँ बोला इंगोली जी, हाँ बोला. बरं, हां हां. पुढचं ते मला वाटतं आज परत मीटिंग होणार होती ना. मीटिंग झाल्यानंतर परत ऑर्डर मला आज म्हटलं होते, नवले सरांचं पण होतं की परत एक ऑर्डर काढू, किती कंटिन्यू करू. ते ऑर्डर एकदा वाचून घ्या, आपण मग डिस्कस करू काय करायचं ते. नवीन आली का? नवीन आली का? हां मग फक्त आपण तेवढंच एक लाईन करून ऑर्डर काढून टाकूयात ना आपण, की शासनाच्या याच्याप्रमाणे 15 तारखेपर्यंत मागील सगळे कोविड संदर्भात ब्रेक द चेन संदर्भातील या काय काय म्हणतात त्याला, नाही जसं आहे तसंच आहे ना, त्याच्यामध्ये बदल तर काही नाही. एकदा काय करूयात, एक दिवस थांबा, सोमवार नंतर आपण डिसिजन घेऊ. हां सोमवारी आपण करू, हां सोमवार नंतर करू. ओके. येऊ देत ना सोमवारी, आपण जे 15% सुरू आहे तसं येऊ देत ना. नाही 15% फक्त, जेवढे लागतात तेवढेच बोलवा, कशात सगळ्यांना बोलवता. हां, जेवढे आवश्यक आहे तेवढेच बोलवा. Then the combination of this vaccine plus hepatitis B hemoglobin is superior to vaccine alone. If we can give this immunoglobulin, that will be helping. The combination prevent hepatitis B transmission around the time of birth, around 86 to 99% of the cases. That means very good responses, we can say. So this is how we can prevent the transmission to newborns. Then various drugs are there like tenofovir, that is given in the second or third trimester, can reduce the risk of mother to child transmission. But only thing is antiviral drugs are comparatively toxic in nature, so that can be the thing. The pregnant women with high hepatitis B DNA, there is no sufficient evidences that hepatitis B immunoglobulin alone during pregnancy can reduce transmission rate to the newborn. So these are the conditions. Treatment we have seen, these are various drugs which are available. That is, the hepatitis B infection does not usually require treatment acute, and it will clear the infection spontaneously in case of acute. But the early antiviral treatment may be required in fewer than 1% of the patients, so it is not much required. Though who infection takes a very aggressive course, that is fulminant hepatitis, or who are immunocompromised. Those who are on the treatment of immunosuppression treatment, to whom we give immunosuppression treatment, various rheumatoid arthritis patients, then various autoimmune disease patient, okay, then any kind of transplant patient. There are so many patients who are receiving immunosuppressants. Who are other immunocompromised agents, those who are in the treatment with glucocorticoid like steroids like drug, because they are although steroids are used as anti-inflammatory, maybe bronchial asthma or ulcerative colitis, etc. In that we are using these agents. So they are immunocompromised patients. Then who are other are immunocompromised, HIV patients, etc. Where because of that, so there are variety of such immunocompromised patients. They are having more chances of growth. The treatment with the chronic infection may be necessary to reduce the risk of cirrhosis and liver cancer. The chronically infected individuals with persistently elevated serum alanine transaminases, that is ALT level, which is a marker of liver damage, and HBV DNA levels are high, so they are the candidates for therapy. The treatment will last for 6 months to a year depending on the medication and the genotype. The treatment duration with the medication is taken by mouth, however, is more variable and usually longer than a year. None of the available medication can clear the infection, but they can stop the virus from the replicating, thus minimizing the liver damage. And still 2018, there are 8 medications which are licensed for the treatment of hepatitis B infection in US. These are antiviral medications like lamivudine, adefovir, tenofovir, disoproxil, then tenofovir, lanfenamide, telvividine, and entecavir. Then 2 immune system modulators like interferon alpha 2A and pegylated interferon alpha 2A. I told you what is pegylated, that is, it is combined with the polyethylene glycol. PEG is a polyethylene glycol. The World Health Organization recommended tenofovir or entecavir as a first line agents. Those with current cirrhosis are in the most need of the treatment. The use of interferon, which requires injection daily or thrice weekly, has been supplemented by long-acting pegylated interferon. I told you this pegylation that causes sustained release or long-acting, where injections are only once weekly. In some individuals, they are much likely to respond than other, and this might be because the genotype of the infection virus and the person's hereditary. The treatment will reduce the viral replication in the liver it will reduce the viral load, and the response to the treatment will differ between genotypes. Interferon treatment may produce an E antigen seroconversion rate of 37%. We have seen E antigen. We have also seen that E antigen may be present in some cases or may not be present in some cases, depending on the genotype of the people. So it is having rate of 37% in genotype A, but only 6% seroconversion in type D. The genotype B has also similar seroconversion of type A, while C is having only 15% of cases. So sustained E antigen loss after treatment is around 45% in the type A and B, but only 20 to 30% in type C and D. We know what is E antigen loss. That means body is clearing these antigens, and therefore they will gradually decrease their level. So what is the prognosis? What will happen after some time? So these are the countries which are having problem. The red are having highest. You can see we are surround in middle range around 60 to 100% type. India is darker comparatively. Those who are having yellow, that means they are having minimal rates, and the dark red are the most cases they are having. Hepatitis B virus infection may be either acute So these are the conditions, these are the situations which are occurring. So persons with self-limiting chronic long-standing persons they will clear the infection spontaneously within weeks to months. However, if it is not, then it will be converted into cirrhosis if it gradually grows. We have seen what cirrhosis is and how it will be affecting. Okay. And I will not go into other history and these details. So this is where we finish the hepatitis. Hepatitis B is more common and more important, so we have done it in detail. If you have any difficulty, you can go through. Please go through the various guidelines and the drugs which are given. If you have any difficulty, you can just get back to me. What next topic to be started, you just let me know on the group, so that accordingly we can start. I'll suggest you to go for the preliminary studies for that particular